Hi everyone, welcome back to our series of snapshots of the CBIG Screen project as presented by our project partners. Today we have the pleasure of speaking to Camilla Fiorina, who's a project manager at Hospinnomics. Camilla, thanks so much for being here. Let me start by asking you to describe the area of CBIG Screen that you're involved in.
Okay, so first of all, thanks for inviting me. As you introduced very well, I work at Hospinnomics, which is a research chair in health economics based in Paris. And as a part of a team people, I am working as a project manager on the working package 4 of CBIG Screen project on behavioral determinants and societal issues around the implementation of targeted CCS programs. So our working package is basically on understanding women's preventive behavior and also bringing out their own views on what are the barriers and facilitators to cervical cancer screening. So in the work package, this will be done in 3 steps. The first steps will be carried out by our partner, Pia from Denmark, who is going to carry out qualitative interviews to women in order to explore the awareness about cervical cancer screening and also their perceived barriers to cervical cancer prevention. Later on, we are using behavioral economics technique to design and distribute a survey to vulnerable women in Romania and France in order to understand how they value different policies for cervical cancer screening prevention, and also to understand which is the design of the policy that may have the highest impact on the behavior, on the preventive behavior of women. And finally, we will also carry out an analysis of the ethical and societal issues that arise around the implementation of targeted policies to vulnerable subgroups of the population.
Great, thanks so much. Very interesting. And could you maybe contextualize a bit how this relates to the overall project and just the work kind of in general to eliminate cervical cancer?
Yes, of course, as part of CBIG Screen, Working Package 4 is part of the collaborative network that the project has built. And as such, it has very strong ties with the other part of the project. So, for example, the policies I was talking about before have been co-designed with the collaboration of all stakeholders during the work of other working package. And also later on, our work will inform the implementation of these policies in the real life context. And also, we are carrying out this project in complementarity with another French project on improving cervical cancer prevention, which is the RESIST project. And it's really similar, they share the same objective. And in a RESIST project, they are going to test the effects of the implementation of a self-sampling campaign in France among vulnerable populations. Put in the general context, by deepening the understanding of vulnerable women's preferences and behavior, our work will contribute to reach the greater aim of tackling inequalities in cervical cancer screening by informing the design of targeted prevention policies in the European context. And we hope that our work, together with the one of other working packages, will help policymakers to design prevention policies that can truly meet women's needs and expectations.
That's great. Thanks so much, Camilla. That's been really informative and really kind of concise, very interesting. Thanks so much. Thanks for taking the time to be here today, and hopefully we'll talk to you soon again. Thank you.
Thank you very much.